Hello out there. This is the irate veteran coming at you with another video. Today we're going to talk about diabetes. But before we do that, let me introduce my sponsors. They are Greg Rada and the folks at West and Dunn. First, let me read this little disclaimer. I am not recommending any specific lawyer or law firm to veterans. Veterans need to conduct their own due diligence before selecting a lawyer or law firm as their representative. With that being said, thank you, sponsors. And now let's move on to talk about diabetes. Okay, so I'm here with one of my sponsors. Let her introduce herself and say something about her firm.
My name is Shauna Dunn. I'm with the law firm of West and Dunn. We're located near Madison, Wisconsin. And I head up the VA disability practice area where we represent veterans appealing their VA disability denials or increased claims from the administrative regional office level all the way through the federal circuit.
Okay, that sounds like pretty full service for veterans who need any help out there. So let's just jump right into this diabetes direct service connection. It looks like there's four possibilities for getting it directly service connected. Although I will say I don't see direct service connection all that often. I see it more in the secondary, but let's cover direct service connection also. So could you go through these?
Yeah, so if you're diagnosed with diabetes in service, it is considered a chronic condition. So a diagnosis in service would mean that you would be service connected for that condition without needing to show any sort of nexus opinion later in life. You can also be service connected based on a diagnosis within 1 year of separation from service. Because again, VA does consider diabetes a chronic condition. So the regulation there at 3.309 lists all of the conditions that can be service connected presumptively if diagnosed within a certain time from separation from service. They have to be compensable in order to have the presumption attach. And then obviously the big one that we see is service connection based on exposure to Agent Orange. That has opened up. It used to be just Vietnam, boots on the ground, then Blue Water and Thailand, now Guam. So the PACT Act expanded that a little bit. So we're seeing another kind of influx of those Agent Orange related diabetes claims because of that. And then we can look at onset based on in-service manifestations of the disease versus in-service diagnosis of the disease. So you're proving that, I had these symptoms in service and ultimately they were diagnosed as diabetes at some point after I was separated from service.
Yeah, so let's go through those a little bit because manifestations, we're just talking about, symptoms, right?
Mm-hmm.
So,
yeah.
And here are some of them. And, I see most of these when I look at, especially, I don't see many type 1 claims. I see tons of type 2 claims, usually mostly secondary, as I've said before. But as far as most of these symptoms are self-observable, so you can credibly report those on a statement if you were suffering from them while you were in service, right?
Yeah, absolutely. I mean, statements are powerful evidence in any claim for service connection. I don't think that they can be overstated in terms of how useful they can be. But you may experience these symptoms and not understand the relevance of them or the seriousness of them. Being thirsty or frequent urination, those are things that may seem like just an inconvenience at the time that they're happening. And especially when you're a young person and you feel pretty good otherwise, those might not lead you to go into the doctor. But, years later, you may see that these symptoms have continued. You finally do get it checked out. They do the blood testing and then they make the diagnosis. Well, those symptoms have been there for this whole time. And certainly your testimony about that can be used in support of a claim.
Yeah, so if we had these symptoms, for example, and we also, let's say in reviewing our own records by BMI, we were overweight, for example, or let's say we had high blood pressure while we were in service, or had low HDL cholesterol, maybe the coupling of the two, having those in-service symptoms and then having some of these possible risk factors, that might lead a possibility for service connection, those two things together.
Yeah, absolutely. So the risk factors on their own, VA has come out with general counsel precedent opinions that say that, just being obese in service is not considered an in-service event or injury. But if you look at some of those manifestations, the actual symptoms of diabetes that we talked about on the previous slide, couple them with the sort of body type or the sort of other testing lab results that may be indicative of the type of person who may get diabetes, that supports that claim. If you can show all of those things together, I think that's certainly helpful as well.
Yeah, so, kind of as I've said, I don't see a lot of direct service connection claims, although I do see a few that claim onset that have those risk factors as well as those symptoms in service. Mostly I see these secondary. Is that kind of what you see too?
Yeah, I mean, we see a lot of claims based on Agent Orange exposure. Obviously, that's probably the number one in terms of diabetes claims. And now we're seeing more and more secondary claims. The increase in claims for service connection for sleep apnea over the last, 5, 10 years, I think led to a lot of secondary claims for diabetes. The new recognition by VA, I guess it's not so new, but the popularizing of the fact that obesity can be considered an intermediate step has certainly led to more claims for diabetes in people who are service connected for musculoskeletal conditions. And then mental health as well, as we said there, depression, PTSD, anxiety, all of those conditions, there's research out there that is shown can lead to increase in weight, which can then obviously lead to type 2 diabetes. The other thing I think that's really relevant is medications. There's certain medications that can certainly cause increased weight, medications that can cause diabetes, period, without that obesity as intermediate step. So paying attention to the side effects of any medications you're taking for a service-connected condition is also really important.
Yeah, so, when we look at the rating schedule, whether it's type 1 or type 2, they're both rated on the same schedule. And whether it's directly service connected or secondary service connected, everyone goes to this rating if they get service connected. I hear some people talk about, they manage their own weight. I mean, is there a requirement that, a dietitian have that weight plan? Is this something that has to be documented?
Well, I think for the 10% evaluation, if you've been diagnosed, so certainly a diagnosis is required, and that's going to require some medical intervention. A doctor has to be involved in that. The 10%, I think if you're managing your diet on your own and you're dealing with your condition by either lowering carbs or lowering calories or exercising more, I think you're still going to get that 10% evaluation, even if you don't have a dietitian directly managing that. This is the minimum evaluation. Once you have a diagnosis, you're going to get that 10%. I've never seen a 0% for diabetes. So I know that, VA is looking for medical professionals to be involved in recommending this treatment. But I think at the 10% level, that's less important. The 20% level, where they're looking for some restricted diet or oral and hypoglycemic agents and restricted diet, there somebody's going to have to actually prescribe you those medications. So obviously, doctor's going to be involved with that. Where it gets a little more complicated, I think, is the 40% evaluation, where VA throws in that regulation of activities. We get a lot of questions about that. Veterans say, well, my doctor told me I have to exercise more. Isn't that what regulation of activities means? And in fact, no, regulation of activities is not actually meant to deal with the hyperglycemia or the high blood sugar, but it's designed to prevent the dips in blood sugar that are just really serious and can send you into an emergency situation. So a doctor would have to tell you that you need to avoid certain activities or certain forms of work in order to avoid those dips in your blood sugar. And so those are really the three evaluations, at least in my experience, that we see for type 2 diabetes, the 60% and 100%. And we have seen some for people with type 2 diabetes rising up to these higher levels. But certainly in type 1 diabetes, I think these are more common situations where you're having these really serious hypoglycemic reactions on kind of a regular basis. You're needing to visit the doctor more frequently for care for diabetes because they're managing insulin and things of that sort. And then looking at the complications. So the complications in the 60% evaluation, if your complications would not be separately compensable, for example, if you had hypertension as a complication, but it's a 0% evaluation, that could be used to help support the 60% evaluation if you meet all those other requirements. And similarly, in the 100% rating, if you meet all of the requirements but don't have that required progressive loss of weight and strength, but you do have complications that would be separately compensable. Maybe you have diabetic neuropathy or nephropathy. Instead of getting service connected separately for those conditions, those complications could be used to support that 100% evaluation.
So anyway, it looks like pretty much you're going to have doctors spell some of these things out. So veterans know that. Make sure that you're getting your diabetes taken care of. I had an aunt who died of diabetes, well, complications from diabetes. So, my favorite aunt, it was, a horrible situation. She ended up having to have her one leg amputated and then the other. And, that she died like a few months after that. So,
Yeah,
make
there's
sure you're taking care of yourself.
Yes. Getting treatment, making sure you're managing things well, getting the appropriate medications, and then making sure those medications are being monitored so that they continue to fit with where your blood sugars are is really important. And diabetes is just one of those conditions that can cause so many other conditions. I think anybody that has it for any length of time is likely going to end up with a complication or two, hopefully just the minor ones, but certainly they can be very serious, even life-threatening.
In the reading schedule, there's a couple of notes. One looks pretty significant. Could you talk about that?
Yeah, I mentioned this a little bit when talking about the 60% and 100% rating criteria. The complications of diabetes can be separately rated. They most likely should be separately rated unless you meet all those other criteria for the 100% evaluation, except for that progressive loss of strength. Then you can use those complications as support to meet that criteria for the 100% evaluation. So in that case, if you need those complications in order to meet the criteria for the 100%, you're not going to be separately service connected for them. If you're not going that route, if you're only at 40, then VA should be separately compensating you for all the complications that have been service connected.
Let's talk about some of those secondary things. Here's just a list I made that I looked up and found that a lot of things are related to, diabetes increases the risk of developing, a number of conditions. But you know what? These things are spelled out on the DBQ, right? So let's kind of talk about those complications. That's even how it's listed on the DBQ. So here's the first set, which is probably what I run into most often. So could you talk a little about that, as well as talks about you'll have to fill out another questionnaire in some cases. Could you talk about that?
Yeah, so I agree. These are the complications that we see most frequently as well. Neuropathy in the hands and the feet, a nephropathy, so the renal condition or kidney dysfunction caused by diabetes, and then retinopathy, which is eye damage caused by diabetes. These are specifically considered within the scope of a claim for service connection for diabetes, so you don't need to claim these separately. You probably should, just in case VA misses it, but if you don't know and you go to this VA exam, the examiner should be thinking about this. They're specifically asked to think about this, and they're going to check these boxes to say you have, neuropathy, nephropathy, or retinopathy. If they do check one of these boxes, then they're supposed to be completing a separate DBQ for those complications. Depending on what the complications are and depending on the qualifications of the person doing your evaluation, you may be able to just get it done right there. They might be able to just get that DBQ, add it to the request and fill it out. Or they may feel that they're not the appropriate specialist, or they may not have the appropriate equipment and they may not be able to do that on the spot. Particularly, I think if you need retinopathy considered, that needs to be done by an ophthalmologist or an optometrist. It's most likely that the person looking at your case there on that exam for diabetes is not going to be either one of those things. So that may result in you having a new appointment set up at some later date.
So in this case, let's say you already know you have, the eye condition related to diabetes. You're already diagnosed. In that case, you probably should claim it secondary, because then they would schedule for an ophthalmologist.
Yeah, if you should just claim it, because relying on VA to remember to grant this as an issue within the scope is a recipe for having to file an appeal. Sometimes they do it, sometimes they don't. And if you claimed it in the first place, they're going to have to. So I would always recommend claiming it. It's a different story if you don't even realize you have it, then this might be a revelation to you when you do the DBQ as well. But I think for the most part, people who are getting treated for their conditions understand that these complications exist.
that was 3A, this is 3B, which goes through a lot more other conditions. And this talks about if it's due to diabetes, and it has a number of conditions here. So basically it's the same as the last slide, that if they check these, there's a good chance that these would be rated separately.
Yeah. And I think the difference between that last slide and this slide are that the diabetic neuropathy, diabetic nephropathy, and diabetic retinopathy are actually attributed in their name, right, to the diabetes. These issues can be attributed to lots of other things, right? You may have essential hypertension, or your hypertension might be caused by your diabetes. You may have a skin condition completely unrelated to your diabetes. So those last three conditions are going to be considered within the scope of the VA claim. These conditions might not be, because there's lots of reasons that these things could develop. So certainly if you have any of these conditions that are a little further removed from diabetes, you will want to file an actual claim for them. Nevertheless, VA is asking examiners to weigh in on this, on the DBQ, because these are common conditions associated with diabetes.
So if they do check yes and then check the boxes, does that also require that they write a medical opinion or would this be sufficient for the service connection?
I think this is the medical opinion. They're saying it's at least as likely as not that the condition is caused by diabetes. So that should be good enough for the rater. I think that's the point of this right here. They likely will need a new questionnaire completed. And same as the last section, you may or may not be able to get that done on the same day. It just depends on the qualifications of the examiner and any additional testing that might need to be done.
And there's another box that asks about permanently aggravated. Worsening of the condition is not due to natural progression. So not only due to, but if the condition's aggravated, then someone could also get those service connected.
Yeah, absolutely. So with any aggravation claim, then we're going to be looking at what was the baseline pre-aggravation level of disability. So that baseline level would be subtracted from whatever the level of disability is on the day of the exam. But yes, service connection can be granted on the basis of aggravation for all these conditions. As we said, a lot of these conditions can occur not because you have diabetes, but for many other reasons. But that doesn't mean that the diabetes doesn't impact them. And if it has worsened them, then service connection can be granted on that aggravation basis.
It's a long DBQ.
Yeah.
So tell me are statements really a factor in diabetes for direct service connection and secondary service connection?
Yeah, I think anytime you file a claim with VA, it's really important to actually explain to them what you're claiming. If you just fill out a 526 and list a bunch of disabilities, VA is going to assume that what you're saying is that these things show up in my service treatment records. And if they don't show up in your service treatment records, then you're probably going to get denied. They can't read your mind about how these things developed. So if you think your diabetes was caused by your knee condition, which caused you to become obese, which then caused you to become diabetic, you have to spell that out for VA. If you think that in service, some of the symptoms that you were experiencing that did not equate to an actual lab test showing glucose levels indicative of a diabetes diagnosis, then you have to explain what those symptoms were and then how they progressed and eventually led you to seek out medical attention and get a diagnosis. As with any condition, you've got witness statements here mentioned. You can have your roommate from service or your girlfriend or your parents who you saw while you were home on leave talk about things like he was tired all the time, or he just couldn't stop drinking, or I remember we were on a road trip and we had to stop every hour for him to go to the bathroom. Those are all things that are observable by anyone and can help pinpoint the onset of a condition in service.
On a secondary basis, putting forth those same theories is pretty important. And that's where I see a lot of statements lacking. So veterans, think about that. Maybe up front on your statement, talk about how you believe it's related to your service, whether it's on a direct or secondary basis. Just point it out so VA knows what you're thinking.
Yeah, and some of those statements don't necessarily have to be really long, right? If you're just saying, I think that the medication I'm taking for this service-connected condition caused diabetes, that's probably all you need to say, because ultimately whether that's true or not is going to be dependent upon what the medical literature says about that particular medication. If you're saying that my knees made it impossible for me to exercise and I gained weight and then I became diabetic, you're probably going to need to spell that out a little bit more. How did that actually impact you? What were you doing maybe previously in order to stay in shape that you couldn't continue doing? And then showing how the weight gain followed that inability to exercise. So, depending on what you're actually claiming, you may need more or less in a statement.
Last question on this slide about IMOs. Is it something that a veteran should wait to get? Is it something they want to get up front? Because a lot of these medical examiners from the VA seemingly are no people. They find reasons to say no. And I'm always the person that thinks, save your money, don't pay for IMOs. Wait, see what the examiner says, and you can always get your IMO later and file a supplemental claim. I mean, what do you think on that?
Ultimately, I think it's dependent upon what the veteran wants. I always look at it as a trade-off between like time and money. If you're willing to get a denial the first time around and see what the VA examiner says and knowing that you can file an appeal and you can always get an IMO later, then I think that's perfectly reasonable choice. If you're like, I'll pay the $1,000, I don't care, and I just want to get this done right away, I think that's also a reasonable choice. So it's just kind of a matter of the person's tolerance for either the weight or the expense. The one thing that I would caution, though, is just because you get the medical opinion doesn't necessarily mean it's going to be granted. VA, one, oftentimes they don't read the things you submit, so that's the biggest problem. Two, even if they do read it, I can tell you how many times I've seen a board certified neurologist's opinion supposedly outweighed by a nurse practitioner's one sentence lack of rationale medical opinion. So they have a strong preference for their own examiners. And even if you present them with something really beautifully done, well supported by someone who's an expert in their field, there's no telling that they won't just accept that VA examiner's opinion instead.
Yeah, my personal preference is to wait to get an IMO simply because, first of all, you might win your claim and get a favorable medical opinion, so why pay for one up front? But then if you do get denied, you'll have their medical opinion that your IMO can rebut. Because I've never seen a single VA negative medical opinion that wasn't easily driving like a truck through the holes.
Yeah. Yeah, I agree with that
Uh,
100%. And that you can get some really beautiful medical opinions rebutting VA's opinions.
Yeah, it's a matter of fact, I've seen so many other medical opinions that I mean, you just wonder, did like a medical person write it? I mean, it's like
Yeah.
crazy. Anyway, so there's one more type. There's a type of diabetes, and I don't even know if I could pronounce this word, insipidus. I've never heard of it. I actually looked this, see how many board claims there were for this, and I found just a few. So if you see this one at all,
I've never seen this either. I've never come across a client who has it. I've never come across someone in service connected for it. So I think it's just one of those rare things, but always good to know that it's there. It looks like the symptoms kind of overlap with the polyuria. So, perhaps symptoms of that sort in service may eventually end up being diagnosed as diabetes insipidus, but I think certainly much rarer.
right? Like I said, I've only found a few claims, never even heard of it till I looked at the rating schedule. That's kind of, we talked about everything that really has to do with diabetes. You have anything else that you want to cover at all?
Yeah, I think that diabetes is just going to be an even bigger deal in the coming years than it has been. Obviously, with Agent Orange being presumptive with Agent Orange exposure, diabetes became a very common claim. Now that obesity can be an intermediate step or obesity can be service connected secondary to another service connected condition, we're going to be seeing more and more diabetes claims coming of that. And I think the chain is going to be really important, right? If you can get diabetes service connected, that opens up the door for so many other things to be service connected. I think it's going to be really important for veterans as they age. It's going to be really important for DIC benefits because diabetes can cause heart disease, can cause stroke, can cause so many things that end up being the cause of death and may open up spousal benefits for the survivor.
Well, no, that's great information. So if that's all you have, goodbye, veterans.